So abroad, the HD patients group has been very, very proactive. HD is very common for some reason in Western Europe and in some parts of South America. So there are many patient active groups which are very, very proactive, and they are the ones who have actually, uh, contributed to research. So there are a lot of um cohort studies ongoing to understand the disease, where families can participate, provide samples, etc., etc., etc. So if we have a coherent group of Huntington disease families in India, it becomes easier to uh, make progress, to ask the government, these are our problems, how can you support. It will help researchers who are trying to understand this disease better. There are a lot of drug trials going on all over the world, actually, and therefore if we have a structured situation where we have a patient registry of HD, and we say, okay, these are the people who have Huntington's disease in India, this is their profile. Going forward, these kind of companies will come forward and say, okay, maybe I can start a drug trial in India too, because there seem to be enough patients here. Right now there is no HD registry of HD patients in India. From our own estimates, we think that there may be 3 to 4 people with HD per lakh in India, and which translates to almost 85,000 or 60,000 individuals with Huntington's disease. We know in our own center we have tested almost 400 patients, and similar numbers from other parts of the country. So at least 3,000 people have been tested positive for Huntington's disease, we know for a fact. So as you would imagine, if one person is having Huntington's disease, that means that parents, siblings, and children, so maybe 2 or 3 or more people in that particular family also may have HD. So there are people there. It is not a super rare condition. We do get patients coming at fairly regular intervals to NIMHANS, and so it is something that requires work, awareness, etc. Yeah, so I would say that I would reiterate the importance again of setting up an HD registry, so that all aspects of Indian patients, their clinical symptoms and their presentations, progressions, etc., can be documented. This kind of information, when available, will help other physicians who are treating them in India. And having a central directory where all doctors who can treat this condition, so that if any patient wants to see somebody in a particular city, can approach them. We try to do that in HDSI to some extent, but we've not been very successful as yet. But from our own personal contacts of physicians, we have tried. So when somebody says I'm in so and so city, we try to direct them to a nearest hospital. So that is a very crucial thing, because often patients need continuous support, and not many centers have that time and the right qualification of people to do that. So that is a big problem. Physiotherapy is important. So there are certain exercises that help with balance and uh, prevention of falls, um, swallowing, etc., which is a very important aspect.